I did yesterday, so
Oh yeah.
for
Oh, Fort Myers.
Fort Myers.
How's their graduation?
It was good. It was awesome.
You know,
I know, my
speaking of that,
my
and
ladle.
cheating,
It's becoming a thing.
like they're still notifying each other. So that's becoming yeah. So I think next year during orientation, they're gonna want you to
Yeah, I was thinking about that.
I know, right? It's Italian. Whatever they call it. I don't know.
Talk about fashion.
You're on the left or the right?
Left.
Where on the left?
You put it on top, you put your stuff on top, right? That's the proper way.
Yeah. Oh, I forgot all my cords on tap.
Well, I brought them because I got to deliver them.
Oh, you must have seen that.
I mean, right?
So you're having a time to my documents.
Yeah.
Get in there.
Nothing.
Take my
This goes back stage, but right now, give me my back. So next year for hiring an vet staff, I have me and Anita been the vet coordinators for this down to the nitty-gritty detail for hours and hours, days and days. Happening. I know. But I think it's gonna be just fine. And I'll just go over this information later. Okay? How is my video?
Testing, testing. I'm gonna do this. Hello. Can you all hear me? Welcome. I think so. Yeah, we got water up there. Yeah. Well, no, I don't actually. It's in my purse.
Thank you.
my graduates can be seated. I didn't know we could get 950 people in here quiet. Where are the babies? They're sleeping. Well, good afternoon, everyone. My name is Stacy Lack Valentine, and I have the distinct privilege of serving as the program director of the NSU Orlando PA program. It is my great pleasure to welcome all of you to this momentous occasion, the graduation ceremony for the NSU Orlando Physician Assistant Class of 2026. Woo! Today, these graduates will be receiving the Master of Medical Science degree from the Nova Southeastern University, Dr. Karan C. Patel College of Allopathic Medicine, and the Dr. Pallavi Patel School of Health Sciences. I would like to extend a warm welcome to the Director of Student Affairs, Dr. Aaron Hackman. Thank you for traveling from the main campus to join us on this special day. I would also like to welcome our commencement speaker, Dr. Miles Bennett. Thank you for taking the time out of your schedule to address our students and guests today. Finally, I would like to welcome the family and friends of all the graduates today, as well as our faculty and staff. Your support and belief in them have been vital to their success. Thank you for all you have done to help them reach this milestone. Class of 2026, congratulations on becoming physician assistants. It has truly been an honor to watch you learn and grow into PAs who provide compassionate and excellent care. Now, I would like to invite the Director of Student Affairs, Dr. Aaron Hackman, to deliver the opening remarks.
To the class of, let's try this again. To the class of 2026, our parents, families, friends, faculty, and distinguished guests, good afternoon and welcome. On behalf of President Moon, the Dean of our College of Allopathic Medicine, Dr. Chad Perlin, our Executive Associate Dean for the School of Health Sciences, Dr. Rob Wagner, and the entire NSU administration, it is my honor and privilege to welcome you and to congratulate the Physician Assistant Orlando Class of 2026. Today we celebrate an incredible achievement. To our graduates, after countless lectures, exams, clinical rotations, presentations, skills checkoffs, early mornings, late nights, and let's be honest, more caffeine than anyone should reasonably consume, you are here. You've earned this moment. But today is about more than a degree, a certification, or a title. Today marks the beginning of a career built on knowledge, service, compassion, and trust. Over the past several years, you have learned anatomy and pharmacology. You have learned to take histories, perform physical examinations, interpret diagnostic studies, develop differential diagnoses, and create treatment plans. As you move forward, remember the people you helped you get here, your families, your friends, your classmates, your professors, your preceptors, and everyone who believed in you when the finish line seemed so far away. And remember the version of yourself you had the courage to begin. So as you enter this next chapter, walk with confidence, but remain humble. Be ambitious, but remain kind. Be knowledgeable, but remain curious. Be independent, but never hesitate to ask for help. And above all, remember why you started. You did not endure all of this to simply earn a title. You did it because you wanted to make a difference in people's lives. Now you have the opportunity to do exactly that. To the Physician Assistant Orlando Class of 2026, congratulations, go forward. Never forget what an extraordinary privilege it is to be entrusted with another person's health, hope, and life. You earned this. Now go make us proud, and congratulations to the Class of 2026.
I have the honor of introducing our commencement speaker this afternoon, Dr. Miles Bennett. Dr. Bennett is a board-certified emergency medicine physician and currently the Vice President and Chief Medical Officer at Advent Health Winter Garden, Millenia, and Ocoee. He is also a fellow of the American College of Emergency Physicians. He received his medical degree from Kansas City University and his MBA from Western Governors University. Dr. Bennett was an emergency medicine resident at the University of Florida and also spent some time as a NASA physician providing medical support for space shuttle launches and landings. Dr. Bennett knows the physician assistant profession well, working alongside PAs and acting as a preceptor for PAs on their rotations and as well during their residency. I met Dr. Bennett when he started working for Florida Emergency Physicians of Team Health over 15 years ago. Throughout that time, he took on many roles, including the medical director of Apopka and Winter Garden Hospital campuses. The students met Dr. Bennett when he was involved in their emergency medicine course. Working alongside Dr. Bennett has been a truly inspirational experience for me. He embodies everything I strive to be as a provider. The way he cares for his patients, his staff, his colleagues is heartfelt and genuine all the time. His calm demeanor and bedside manner puts everyone at ease, even in the most stressful situations. The class of 2026 and I are honored to have learned from such an incredible provider and teacher. Please welcome Dr. Miles Bennett.
She's far too nice. It's very wonderful to see you. I'm very excited for you all. It's excited to look out there and see a bunch of colleagues who'll be working shoulder to shoulder with me to take care of patients here in the community. I was very honored and humbled to be asked to do this. I tell you, I thought I had a little bit more time to get the butterflies out. And in class, if you remember, I talk fast. So I have my wife sitting back there. She's going to wave if I talk way too fast. And you guys can do the same. And I'm used to, if you remember in class, I have this problem. I have to walk around a lot, and I have to stay right here. And I can't ask you guys any questions. So you're all safe from that today. But again, I thank you for this opportunity. I really feel fortunate to be able to come spend this time with you on this special day after all you've gone through. And I want to share a message with you. I hope you remember at least part of what I have to say. And I was asked to share it through the lens of the roles that I've had and what makes a successful provider, through the lens of a hospital administrator, through a medical director, through a colleague, and through a patient, and one day, hopefully not, but one day you're a patient. And I want to start off by talking a little bit about the roles we have and how that goes on with character. And I'm going to start out with a story. It's a personal story. When I was born with a problem where I couldn't walk very well, and they thought I'd outgrow it. And by the time I turned 4 years old, I hadn't outgrown it. So my parents took me to an orthopedic surgeon who said, probably need to require surgery. Well, my parents, that kind of scared them, their little 4-year-old child going through that. So they took me to another orthopedic surgeon. He just said, let's just try something different. Let's try ice skating. And we had a neighbor, and thankfully, nothing against figure skaters. Thankfully, he was a hockey player, not a figure skater. So for the next few months, he helped us gather the equipment, get the equipment. I went to hockey games with my dad. I watched games on TV with my dad. I tried that gear on probably 100 times, looked in the mirror. And the thing that disappointed me is I looked like a hockey player, but I still had my teeth. So that was odd. So the big day came for me the first time to get on the ice, and I was going to get a hat trick. I didn't know what a hat trick was, but it seemed pretty cool. And I put all my gear on. I looked in the mirror one more time, and I looked like a hockey player. Then I got out, and I walked out there, and I took my first step on the ice, and I was on my back. And that's what we're going to kind of talk about today, is that right now, it's easy for us to look the part of a medical professional, but it's hard to have the character and to be the part of a medical professional. You can wear the white coat, you can have the stethoscope, all of you know the vocabulary words that most people can't say it or spell. You can give a polished presentation, and you can confidently stand at the bedside and take care of a patient. And you'll never have the same experience of me falling flat on your back because you guys are amazing. But you need to be careful. And that's what we're going to share today, is talking about character and being the part of a medical professional. Being the part is not about the coat you wear. It's about what's inside of that coat. It's about what you do when no one is evaluating you, when no one is watching, when the answer is not obvious, and when being caring and compassionate is not going to be easy. Today, you're graduating because you've demonstrated you have the knowledge and skills necessary to be a medical provider. But the diploma you receive today does not complete your formation. Sorry. It begins it. Your patients will not experience the transcripts that you have. What they are going to experience are whether you listen or whether you interrupt them. They're going to experience whether you see the person or you see a diagnosis. They'll experience whether you are present or distracted and preoccupied. They'll experience whether you are humble enough to ask for help, courageous enough to speak up when it's necessary, and compassionate enough to care. They will evaluate and experience you. You're going to have many wonderful times having these experiences with your patient. You're going to tell patients that have been trying for years to have a baby that they're pregnant. You're going to tell someone that's been struggling with cancer for a long time they're in remission and there's no signs of cancer. And you're going to tell that person that thinks they're dying of COVID that it's just allergies. You're going to have those wonderful experiences, but you're also going to have trying times. You're going to have challenges. They're going to test the character and who you are. How are you going to tell that family that their 2-year-old child that was found in the pool is never going to return home with them again? And how are you going to tell that patient that you have to tell it over the phone that her 35-year-old husband has passed away and you have no idea why? Or you have a young woman that's getting ready for her wedding and she's so excited and you find out that she has metastatic cancer and she probably has not much longer to live. These were my patients and these are going to be your patients. The question now is, are you ready to be the part of the medical profession and not just look the part of the medical professional? Looking the part is easy. You can just put a white coat on, a stethoscope. People on Hollywood do it all the time. I want to share a story of someone that really impacted me. And the exciting thing is she actually graduated from your program. As you know, I love your program. I hired a lot of people from your program. So if you're still looking for a job, let's talk. She came into the room, and I wasn't stalking her, I promise. I just happened to be outside visiting with a nurse. And she came into the room, and she shook the hands and introduced herself and sat down. And when she sat down, she actually recognized something in the patient. She saw the anxiety in the face. And before she kind of jumped into everything, she says, I want to talk about what brought you in today, but you look very anxious. I'm worried about you. What is on your mind, and what are you worried about? And then she paused. And in that moment, it gave the patient an opportunity to say, I've had family members die of cancer, and I'm worried that these symptoms are cancerous. I haven't gone to my PCP in years, and I didn't want to come to the emergency room, but my husband drugged me in. And after hearing this, the provider put her head on the woman's shoulder and told her that we're a team, we're going to do this together. I can't promise the outcome, but we're going to get through this together. It would have been easy and quick to go in and ask what things are, go through everything really quick. But she showed compassion and empathy, skills that you need to learn to have and to hold that they don't teach in school. These are skills that must be pulled from you as an individual. The community fully expects you to be competent, and you guys are competent. I know that for a fact. During education, you've learned how to take a history, perform a physical exam, develop a differential diagnosis, interpret testing, and create treatment plans. But compassion and empathy are not taught in school, and compassion is not sentimentality. It's not avoiding those difficult conversations. Compassion sounds like reassurance sometimes. Sometimes it sounds like an apology. Sometimes it just sounds like silence. And sometimes compassion is actually saying to a patient, I am concerned and I need you to understand how serious this is. Compassion also rolls into, if you're a compassionate individual, that's just going to roll into you being a humble individual, and that is very important. Another example, again, a student that graduated from your school, he had just been out for a few weeks from the residency program, and he had a patient that seemed very straightforward. It was a very busy day. He had taken care of a lot of patients, but something just wasn't sticking right. The patient seemed sicker than the lab test, sicker than the imaging studies. And he just said it doesn't feel consistent. So he came to me and he said, this doesn't feel consistent. I should know the answer to this. Everything seems good. We reviewed this, and just talking to me, he went through this and I said, this is what I want to do, X, Y, and Z. Came up with a plan. He put the additional tests in, and within just less than an hour, we had the results back that this patient actually had a life-threatening condition. It would have been easy just to send that patient home because everything looked good. And it'd be tempting to say that the medical knowledge is what, the knowledge of this PA is what saved the life of this patient. But knowledge was just a tiny part of it. The patient was protected and safe because the medical provider was humble enough to say, I may be missing something. There will be moments in your life where you're going to be the smartest person in the room. Many times in your life that will happen to you. But there'll also be moments where you are not the smartest person in the room. The wisdom is knowing the difference between those two situations. As my colleague, I may actually come to you and talk to you. I'm agnostic to the degree. I may need your help and come to you and ask you for help. One of the most dangerous temptations in medicine is the pressure to appear confident all of the time. Confidence without humility becomes arrogance. And arrogance prevents learning, silences questions, and places all of our patients at risk. Being the part means understanding that asking for help is not evidence of weakness. It is evidence of responsibility. You're entering a profession built on collaboration, and you will work beside physicians, nurses, pharmacists, nurse practitioners. Every member of the treatment team matters. Learn their names. Listen to when they raise concerns. It may be the nurse has been with the patient for 12 hours that raises a concern that something doesn't seem right. It may be the medical assistant that says, the patient just doesn't act like they usually do when they come on to visits. It may be the pharmacist questioning your dose. But it also might be the family member that just says, this is not normal for her. It also means caring when your effort will never be recognized. Imagine at the end of a long shift, everything's just been kind of going wrong that day. You just can't wait to get out of there. And you go in there to talk to this older gentleman's by himself, and he looks confused. He's probably confused because his wife isn't there to explain everything to him, but he's confused. And so taking the extra moment to sit down with him, tell him what he has, go through the instructions again, have him talk back what he knows. You find out during this conversation that he couldn't afford one of his prescriptions. And you also found out that appointment you scheduled so painstakingly for him, he can't actually have a ride to. No one's going to applaud you for having that decision to take that time. And it's not going to appear in your annual evaluation. No one will ever know besides you and that patient. But it is what being the part actually means. Professional character is often revealed through small decisions that no one else will ever see. Did you follow up on that result you were worried about? Did you speak respectfully about the patient after leaving the room? Did you advocate for the person who had no influence, no connections, and no ability to reward or even pay you? These are small questions, and they're the questions that determine what kind of clinician you will be. You will face a lot of challenges from administrators. You're going to have expectations for staffing challenges, how many patients are you going to have to see, all of those things. And there will be days that your compassion feels inconsistent and inefficient. And there will be moments when slowing down feels impossible, but you will not always have unlimited time. But if it doesn't always take unlimited time, sometimes it's just an undistracted 10 seconds, just pulling the chair a little bit closer to the patient, a hand on their shoulder, a moment of eye contact, and a sentences such as, "I can see you are worried," or "I believe you," or "It is such a good thing you came in today." Words like these may not appear in any treatment guidelines. They're not going to be in any treatment plans, but they are part of the treatment, and they're part of you as a character and being the part of a medical professional. I'm going to share with you 5 things, and I've talked about a few of them, but I just want you to remember these 5 things, and there will be a test on this after. And these are the 5 commitments that you're going to make. The first is be competent. Study after the examinations are over. Remain curious. Read about the patient that you didn't know everything about. Invite feedback, especially when it's uncomfortable. Never allow today's degree to become tomorrow's excuse to stop studying. Second, and I've touched on this, so I'm only going to touch on it briefly, is be compassionate. Do not let familiarity with illnesses make you indifferent to suffering. And just remember, while those diagnoses may seem routine to you, they are new and scary for your patients. Next one I've talked a little about too is be humble. Know what you know and know what you don't know. Ask for help early. Remember that being corrected is far more important and better than realizing you actually harmed a patient. Fourth, be courageous. Speaking when something feels wrong. Advocate for your patients. Challenge disrespectful behavior between colleagues. Tell the truth when errors happen. Courage in medicine is not often dramatic. More often, it is the decision to say what is necessary in an uncomfortable situation. And finally, be dependable. Return the call, complete the handoff, follow through, do what you tell patients you're going to do. Graduates, there will be many opportunities in your careers to look impressive. You do today. You're going to have titles, you're going to have credentials, you're going to have awards, publications, leadership positions, and you're going to have many photographs in your white coats. There is nothing wrong with accomplishment. Please don't take that's what I'm trying to say today. But accomplishment and identity are not the same thing. Accomplishment is what appears on your resume. But identity is who you are when the resume no longer matters. Accomplishments may help you enter the room, but character determines what happens after the door is closed. Years from now, your patients will not remember exact medication you prescribed. They're not going to remember the procedure that you did. They're not even going to remember your title. What they're going to remember is, did they trust you? Did you care for them? And you will actually remember the moments that you chose to be kind, the kind of clinician that you thought that and that you wanted to become. Today, your families see the cap and gowns. They're going to see the degrees. They will see the results of all your years of sacrifice. Your patients will soon see the badges, the credentials, and the white coat. They will assume that you're ready. Your responsibility is to spend the rest of your career becoming worthy of that assumption. So wear that coat proudly. You've earned it. Carry the title confidently. You've earned it. Celebrate what you have accomplished. You've earned it. You have earned this moment, but when the ceremony ends, when the photographs are all taken, and when you enter the examination room for the first time, remember these things. Do not merely look prepared, be prepared. Do not merely appear compassionate, be compassionate. Do not simply perform professionalism when others are watching. Be professional when no one is watching. Do not only look the part, be the part. Again, congratulations, graduates, and just remember, may you practice with competence, lead with humility, act with courage, and never lose the capacity to care. Congratulations again. Thank you.
Thank you, Dr. Bennett, for sharing those special words. On behalf of the faculty, staff, the whole PA program, we wanted to present you with a certificate of appreciation that you can hang proudly for being such an inspiration to us and coming today to share this. Thank you. Oh, you want more? Oh, one more.
Okay. There we go. That's good. Eyes open. Here goes the quote. Gotcha.
Okay, so now on to the next part of our ceremony, one of my most favorite parts, which are the awards. What an honor it is to stand before you and present these two special awards and induction into the Honor Society. So the two awards we'll be giving today are the Dean's Award and the President's Award. We will also be inducting students, faculty, and alumni into the Pi Alpha Honor Society and the Alpha Eta Honor Society. To each of you receiving these distinctions, your achievements are remarkable and your contributions have elevated this program and your peers. You've set a standard for future cohorts to aspire to. Congratulations. First, the awards. So first we will do the Dean's Award. The Dean's Award is presented for academic excellence to the student graduating with the highest scholastic achievement in their class. This year's award recipient is Sarah DeVogel. Please come up. Our second award today is the President's Award. The President's Award is a prestigious award presented by the faculty to a student who best exemplifies the characteristics of a PA, a combination of scholarship, leadership, integrity, humanity, and loyalty to the profession. This year's award recipient is Emma Stevens. Now I'd like to invite Dr. Kaplan to help me induct the new members into our honor societies. Okay, our first honor society today is the Pi Alpha Honor Society. Those who were chosen to be inducted into the Pi Alpha Honor Society represent leadership, scholarship, and service in the PA profession. Pi Alpha is the National PA Honor Society organized for the promotion and recognition of PA students, faculty, alumni, and honorary members. Membership signifies inductees' significant academic achievements and honors them for their leadership, research, community, professional service, and other related activities. The society also encourages a high standard of character and conduct among students, faculty, alumni, and honorary members. The motto of Pi Alpha is scholarship, service, leadership. The organization is committed to lifelong learning and participation in intellectual life.
Okay, when your name is called, please come up to the stage and receive your cord, pin, and certificate. Caritza Ayala. Carly Brown. Imani Garcia. Chelsea Hahn. Cassandra Lopez. Munima Rahman. Emma Stevens. Eva Vandalist. Nathaniel Weaver. Our faculty member induction is Dr. Linda Stewart. And our alumni induction is Professor Jorge Muniz.
Okay, the Alpha Eta Honor Society. We are very happy to celebrate and induct a group of outstanding nominees, including faculty, alumni, and soon-to-be graduates, into the Nu Sigma Upsilon chapter of the Alpha Eta Honor Society at NSU. Alpha Eta is the National Honor Society for Health Professions, recognizing individuals who demonstrate outstanding academic achievement, leadership, integrity, and professional excellence. Membership is limited to a select group of students, alumni, and faculty. The name is derived from the Greek for the first letters of our profession, Allied Alpha and Health Eta. Inductees into Alpha Eta now come from two colleges at NSU, the College of Osteopathic Medicine and the College of Allopathic Medicine. The society was founded in 1975 and has 93 chapters nationwide and has inducted over 35,000 members. The Nu Sigma Upsilon chapter of the Alpha Eta at NSU was established at the College of Healthcare Sciences in 2009. Our chapter currently consists of over 1,000 members and continues to grow every year. Membership in the society is awarded to those students, faculty, and alumni that demonstrate high academic achievement, along with a capacity for leadership and achievement in their chosen allied health field. Our motto is Together We Serve, recognizing that healthcare is dependent on a team approach, and every member plays an integral piece to the quality healthcare delivery in the U.S. and beyond. Within our chapter, we have representation membership in the areas of audiology, anesthesiologist assistant, occupational therapy, physician assistant, physical therapy, nutrition, cardiovascular sonography, medical sonography, speech-language pathology, exercise and sports science, and health science. All of these disciplines united as one, demonstrating the importance of a healthcare team devoted to improving patients' well-being and promoting quality healthcare. Nominees need to have an overall GPA of 3.5 in baccalaureate programs or 3.8 in graduate programs. Nominees also must demonstrate capacity for leadership and achievement in their chosen field. Members are nominated by their department chairs with the recommendations from program faculty. All nominations need to be approved by the Nu Sigma Upsilon Executive Council. The local NSU chapter activities include sponsorship and participation in activities that support the community and the professions within our chapter and promote growth in our membership. The chapter looks toward its growing membership to become more involved in university and community events. This is a very exclusive organization you are being inducted to, and we are proud of your accomplishments and the great things to come.
When your name is called, please come up to the stage to receive your cord, pin, and certificate. Brenna Bax. Alana Brophy. Jada Carpenter. Sarah DeVogel. Christina Fan. Courtney First. Sarah Green. Gabriella Menena. Gabriella Nakla. Paige Petrus. Kaylee Ramsey. Kaylee Summers. Our faculty member induction is Professor Sung Kim. Our alumni induction is Professor Ashley Green. At this time, I'd like to invite Emma Stevens to the stage to present the Golden Apple Award and the Preceptor of the Year Award.
Good afternoon. My name is Emma Stevens, and this is Gabby Manana. We are here to hand out the student voted awards for the Golden Apple and the Preceptor of the Year. First, I'd like to thank all of the friends, families, and loved ones who have supported the class of 2026 for the last 27 months. I'd also like to thank our faculty of the Nova Orlando Physician Assistant Program for your dedication and support. It is now my honor to present the Golden Apple Award. Each year, the graduating class nominates and selects a faculty member who has made a truly positive and lasting impact on their journey. While every member of our faculty has contributed to our success, one professor became much more than an educator to us. This professor has created a space where every student feels welcome. Whether we needed a quick snack, a moment to draw on the wall because she had pictures on her door, or simply someone to listen after a difficult exam or a hard day, her door was always open. She reminded us that it was okay to ask for help, to celebrate our successes, and to give ourselves grace when things didn't go quite as planned. She has celebrated our victories, helped us prepare for interviews, and has offered guidance as we navigated our careers, and been a source of encouragement through every stage of this program. More than anything, she's made us feel seen. She didn't just teach us how to become better physician assistants, she has taught us how to care for ourselves and each other. On behalf of the class of 2026, thank you for your kindness, your compassion, your unwavering support, and believing in us long before we believed in ourselves. It is with great appreciation and admiration that I present the 2026 Golden Apple Award to Dr. Linda Stewart.
In addition to great professors, we also get the opportunity to learn from amazing preceptors throughout our clinical year. Not only do they invite us into their practice, they entrust us with their patients. They really do facilitate our real-world learning. On behalf of the class of 2026, it is an honor to be able to present this award of Preceptor of the Year to 3 amazing clinicians who inspired us, guided us, and believed in us every step of the way. Please give a round of applause to Dr. Maxwell, Dr. Santos, and Carson Wagner, PAC. And if any of you are here, we invite you to come to the stage at this time.
We'll ship it out.
I thought Dr. Maxwell was here, but there's so many. Dr. Maxwell, are you out there? No? You're hiding. Well, congratulations to our preceptors. We really, as faculty, we, grow them in home, and then we send them out and we entrust our preceptors to take care of them and guide them. And it's really an honor when they have such a wonderful experience. So thank you to all of our preceptors that are here today. Okay. So we've had all of our awards. We've had our addresses. It is now time for you to walk across this stage and begin your careers as PAs. I have the privilege of presenting the class of 2026, who in judgment of the faculty will be receiving the Master of Medical Science degree and Physician Assistant. Will the class of 2026 please stand? And the front row, would you please go ahead and approach the stage? We'll have Dr. Linda Stewart greet the students as they come up and graduate. And Dr. Jonathan Kaplan, please read the candidates' names.
Kaylin Lagunza, high honors. Silji Lal. Nadia Siegel. Christy Salter, high honors, SGA FAPA representative. Courtney First, high honors. Christina Allen, high honors. Lily Marciano, honors. Grace Ilias, high honors. Alyssa Khan, honors. Sonali Patel, high honors. Usmi Patel, high honors. Isha Patel, high honors. Sridhika Padamatinji, honors. Mansi Patel, SGA Diversity Chair. Felicia Alley. Aaliyah Cawley, honors. Caritza Ayala Gonzalez, honors, SBA Culture. Gabriella Menena, high honors, SGA Treasurer. Kaylee Summers, high honors. Simran Kandola. Anna Voyatsaglu, honors, SBA Secretary. Dala El Hadi, honors, SGA Mission Trip Chair. Nadina Shadich, honors. Muniba Remen, honors, SGA Social Chairs. Abigail Stremka, high honors. Christina Young, high honors. Hannah Gutentag, high honors. Callie Rich, high honors. Lauren Fritz. Sana Mithwani, honors. Gabriella Margarita Nakla, high honors. Emma Stevens, honors, SGA, SAB representative. Cassandra Lopez, honors. Natasha Crawford, honors. Eva Vandalist, high honors. Yadilex Ali, honors. Jada Carpenter, high honors. Brenna Bax, high honors. Sarah DeVogel, high honors. Nathaniel Weaver, SGA AAPA rep. Anthony Joseph Casper, honors. Adam Waters, honors. Edmund Reekers, high honors. Benjamin Vu, Honors SGA President. Tristan Roman, Honors. Emily Rivas, High Honors. Caroline One, High Honors. Madison Quattrell, Honors. Paige Petrus, High Honors. Kaylee Ramsey, High Honors. Amanda Davis. Christina Fan, High Honors, SGA Historian. Carly Brown. Lily Canaleo, Honors. Caitlin Gobon, Honors. Alana Brophy, High Honors. Chelsea Hahn, Honors, SBA Vice President. Imani Garcia, High Honors, SBA Mission Trinitarian. Sarah Green, high honors. Jared Bond, high honors. Kevin Dominique, honors. Jonathan Zagrobo.
Our tallest graduate. Will the class of 2026 please rise? On behalf of the NSU Orlando PA program, I would like to officially congratulate the class of 2026 on receiving their Master of Medical Science degree. Congratulations, class of 2026. Please remain standing, class of 2026, for the reading of the PA oath, which can be found in your graduation ceremony program. I would now like to welcome Professor Jorge Muniz to the podium to read the PA oath.
Thank you, Dr. Leck Valentine. Will the class of 2026 please join me in reciting the PA oath? I pledge to perform the following duties with honesty and dedication. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will uphold the tenets of patient autonomy, beneficence, non-maleficence, and justice. I will recognize and promote the value of diversity. I will treat equally all persons who seek my care. I will hold in confidence the information shared in the course of practicing medicine. I will assess my personal capabilities and limitations, striving always to improve my medical practice. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine. I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to an improved community. I will respect my professional relationship with the physician. I will share and expand knowledge within the profession. These duties are pledged with sincerity and upon my honor. Congratulations.
You can be seated now. Thank you, Professor Muniz. As we conclude today's event, I hope you will remember to remain as proud of yourselves as you are today. I would like to again thank the faculty and staff for their tremendous efforts teaching and growing our newest PAs, our family and friends for their support and attendance today, as well as our special guests, Dr. Hackman and Dr. Bennett, for sharing their inspiring words. Class of 2026, I am proud to officially call you my colleagues. Congratulations. My faculty will please stand up, and we're going to process out in reverse order of the way that we came. So if students would like to, graduates, PAs would like to rise, they know. Graduates would like to rise, and we will lead the procession for you.